Welcome back. All week long, we've been chatting with medical experts about the coronavirus and how to best protect ourselves and our children. But what about expectant mothers? What do they need to know to stay safe during this outbreak? Today, we are welcoming Dr. Kirsty Agard, maternal fetal medicine specialist at Texas Children's Pavilion for Women and Baylor College of Medicine, to answer some of your questions. Welcome to the show.
Thank you for having me. It's a pleasure to be on.
Of course, we definitely appreciate your time, and I know we've received a ton of questions. Let's get right to them. First of all, if a pregnant woman is exposed to COVID-19 or is infected with COVID-19, can she pass that onto her unborn child?
That is a really great question, and I'm going to take just a minute or two to answer it because I think it's an important one right now. So historically, we've always said that when women are infected with even severe respiratory viruses, it's very unusual that they would pass them to their unborn babies while still in the womb. However, this question's got a little bit muddled up in the last 24 hours with 3 papers that were published in medical journals. I think, though, the take-home message is still the same. It's highly unlikely, or it may occur in very rare circumstances with COVID-19, that a sick mom is able to actually pass it to her baby before it's born. And I'm happy to explain that a little bit more if you want.
Well, I think that the fear is something that that is on a lot of people's minds. Why don't we talk about some of the practical applications, things like going to the grocery store or seeing family or even going to work. A lot of pregnant mothers may be wondering if these daily activities are things that they should continue participating in these days.
So I think that's really where following the stay home, work safe recommendations are crucial. So if you're keeping that social distancing and doing a great job of really, obligating both the intent and the purpose of that, you should be A-OK. One of the things I like to remind our patients is that just because they're pregnant, they're not at increased risk of getting infected. It's just that if they get infected and get COVID-19 disease, there's a little bit higher chance that they could have some bad outcomes because of that. But the likelihood that they would just get infected is really no different than any other non-pregnant woman their same age, with their same medical risks, or men. Those risks of infection are unchanged.
And I think that answer you just gave will help ease a lot of fears. What about prenatal appointments? If someone out there is pregnant, they might be wondering, should they continue going to see their doctor for these appointments?
Great question. We have all been working around the clock trying to figure out ways that we can still continue to see patients. And by see patients, it's going to be just like we're doing now sometimes, where we're even giving women blood pressure cuffs so they can check it at home, and we'll call in and we'll have telemedicine visits. But in some situations, for some pregnant women, it's going to be really important that you not change that care. The answer to that is have a conversation with your doctor or your midwife, and together we'll figure out what's the right solution for you. Our doors are open and we're here to take care of pregnant women, but we want you to call in advance first and figure out what's the safest way for that to happen.
What about for breastfeeding mothers? They may be wondering if there are extra precautions, Dr. Agard, that they need to be taking during this COVID-19 pandemic.
Great question. So for breastfeeding moms who aren't infected with the SARS-CoV-2 virus that causes COVID-19, the recommendations are the same. The benefits of breastfeeding are extensive. And in fact, those antibodies that may be protecting you against COVID-19 infection are the same ones you can pass to your baby through the breast milk. So for goodness sakes, this is not the time to stop breastfeeding. That said, doing a really good job of washing your hands very carefully and keeping your breasts cleansed is really crucial, just like it would be in any other kind of common virus setting.
So hygiene is key, number one priority.
Hygiene is key. Hygiene is key, especially making sure that we're washing our hands really well after we change our babies and before we put them on the breast, or before we even are grabbing them with their hands and moving them around. Really being good about that great hand washing is really crucial, we think.
And Dr. Agard, for pregnant women out there who may believe that they have been exposed to COVID-19, what steps should they be taking right now?
Call and reach out to us and let us work through that together on a case-by-case basis. There are some women who may indeed have risks of exposure, and we can figure out with you how to get that testing accomplished. We are so fortunate at Texas Children's to have such amazing partners in our lab testing that we are up and running, and we can do a lot to help figure that out. But we need you to call us, and we can work through that with you one-on-one.
And Dr. Kirsty Agard, I'm reading here that you've raised 3 children on your own. You are the recipient of the Houston Women's Magazine Maximum Mom Award, awarded to a woman who has been an extraordinary mother to her children. We've got to leave it there for today, but thank you so much for your work.
Entirely my pleasure. Be well, keep washing those hands, and take care.
All right, will do. We will see you soon. A reminder that in the meantime, you can find more information by visiting Texas Children's Hospital online, texaschildrenscoronavirus.org.